through tough times before. And throughout our city's history, we've repeatedly demonstrated the power of coming together in common cause. Now is the time for us to do so again, because we all have a part to play in preventing the spread of the virus and helping to save lives. So I'd urge all Londoners to pull together and to stay united as we seek to navigate our way through these difficult times. Chair, thank you. I look forward to answering any questions.
Thank you very much. Now, look, I'm going to go back to the order of party groups asking questions from the order paper, but I'm going to assure people, even though we've got limited time, we're going to get through all their key points and everything else. So we'll start with Onkar Sahota.
Thank you, Mr. Mayor. Thank you very much for your leadership in dealing with this crisis across London. I also want to thank the Deputy Mayor, Twycross, for all the hard work you've done in making sure that London is resilient and able to cope with this. I also want to thank the frontline nurses and doctors and the public health staff and the cleaners and the porters in the hospital and all those people in the gig community and all those essential services, because they may be, some of them may be low paid, but they're not low skilled, and we really value them, and I want to thank them also for the hard work they're doing. I obviously am going to focus on the NHS because that's where I specialise in, and I know my colleagues will ask questions on other areas. And I, of course, bring a perspective of being a frontline GP who's on the front line. And I know the strategic thinking is absolutely right, but how do we get those decisions down to the ground is what's important. You can have all the best strategy in the world. If you don't implement it correctly, then we won't be able to achieve. So first thing I want to ask is are you assured that the decision-making in London is coordinated and is getting down to the ground? The reason I ask, for example, is that as members of staff are getting sick in surgeries, they're facing problems keeping surgeries open. And when they're going to the CCGs and saying, look, we need to do X, Y change in our practice, they've been told, we refer you back to the contract. We can't keep being referred to the contract. We need someone to be making decisions, allowing practices to respond to the crisis they're facing in delivering the services. So who's making those sort of decisions?
Thank you for your comments about the bravery, the dedication, the professionalism of everyone on the front line. And you're right to remind us they're not just brilliant doctors and nurses, but they are cleaners, there are others who are essential workers in London. So a number of responses. So we from City Hall have a strategic coordinating group, and there are 4 chairs of that: John Barradell from City of London, Fiona Twycross, Eleanor Conway from Sadiq, and Deputy Assistant Commissioner Lawrence Taylor. And then underneath the SCG are various subgroups, one of which is health. And I'll bring Fiona in to explain the structures which are important to give you the reassurance. In relation to your really important question in relation to resources, the Prime Minister has said this again and again, that whatever resources are needed to save lives, they will be there. Whatever flexibilities are needed in relation to contractual arrangements are there. And so nobody who is a lifesaver should worry about contracts, that will be there. The Secretary of State for Health has also spoken to, with the Prime Minister, those who could be assisting with more ventilators, respirators and other issues to make sure they are there as well. A concern expressed to me has been the provision of protective equipment for frontline staff. This point has been made to the government and they have said they will accelerate this. The concern clearly is some people who already may have been treating patients without the right equipment could have been infected. I'm also concerned about the lack of testing for those essential workers who should be out there treating but could be self-isolating because a member of their family has symptoms and they may not have themselves the coronavirus. And one of the things we want to do is to triage those tests that there are, so those who are on the front line, particularly NHS workers, can be tested. If they've not got the virus, they can get back out there and help people with these conditions. I want to just deal with the structures because they're quite important for the reassurance and to make sure there's proper checks and balances.
Good, thank you. Yeah.
Absolutely. So the London Resilience Forum has a statutory responsibility for preparing for and managing the strategic coordination around any sort of major incident. We actually learned quite a lot from the Brexit no-deal planning in terms of how to deal with an issue or a crisis over a longer period of time. So we've set up, under the London Resilience Forum, which I chair on behalf of the Mayor, a London COVID-19 Strategic Coordination Group, and this is responsible for determining the strategic aim, objectives and priorities for the response to an incident on behalf of London. And there's also well-rehearsed routes into government through MHCLG from the London Resilience Forum and the SCG. So the Strategic Coordinating Group is a decision-making body for the response phase. It's about sharing information, but it's also about sort of setting the direction and priorities as we go through, and to give a broad overview and represent each agency's interests and statutory responsibilities, which obviously vary slightly between the different agencies. So the SCG's got a leadership role. It also has established a number of subgroups, bearing in mind that there's a lot of different strands of work that need to be carried out quite rapidly. So we've got a number of subgroups reporting into the Strategic Coordination Group, which helps us decide the strategy and implementation of strategic objectives. And if it's helpful, I can go through those subgroups briefly. So it also ensures the coordination and delivery of consistent public and media messages. And in each sort of incident, it will be decided who the lead agency is. And in this case, it was a unanimous decision by the partnership that, given that it's a system-wide issue, albeit one that's triggered by a health crisis, that the Strategic Coordination Group should feed in direct through me to the Mayor, because the Mayor has a role both as a Cat 1 responder, but also as a clear spokesperson for London. So if I just mention briefly, and maybe others might like to come back on it, a bit more about the structure. We've got a health oversight subgroup, which the Mayor has referred to, which has the NHS, PHE and ADAS, so it covers social care as well. And that coordinates a response from the healthcare system perspective, including the delayed transfer of care between the NHS and local authority social care, which is more commonly known as bed blocking, to ensure that doesn't become an issue that clogs up the system. We also have an excess death subgroup, which is led by a local authority lead. This is going to oversee the preparations, ensure that any excess deaths as a result of the COVID-19 outbreak continue to be dealt with dignity and respect, and as close to normal procedures as possible. We've also, and there was an announcement about fundraising and volunteering yesterday by the Mayor, we've got a subgroup on community volunteers and fundraising, which will provide coordination of the funding arrangements, volunteers at a community level to support those made vulnerable through self-isolation, and link into structures here, as well as making sure the voluntary sector is coordinated. Obviously communication and clear communication is key, so we've got a communications group which is to provide consistent communications between partner agencies and ensure that London partners provide consistent messaging to the public from the LRF structures. We've got a business sector subgroup which is GLA-led, an information cell which is intended to provide a single source of information for the SCG on the current and potential future impacts of London. And finally, and apologies for the long list of subgroups, we have a scientific and technical advice cell which is led by PHE, which is intended to make sure we have a single point of trusted and credible scientific and technical advice to the London SCG and the Mayor, to make sure that in the midst of a range of rumours out there, we make sure that